The following program is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of News Channel 11.
I have patients coming in the office every day, and their big question is, how do I fix this? And so what we'd like to talk to today is, what is this? Patients don't have the fog's idea so often whether they need a Botox because of their brown spots or things, and they have no idea which thing works for which. So we're going to talk about it. And a lot of what we decide to fix is based on what's wrong. And a lot of reasons for an aging, sagging, sad face. You have the environment, natural environment, you have the heat, you have the humidity, you've got sun, you've got tanning beds, you've got the heredity component of it, you've got the things you're doing to your face or haven't done to your face. So essentially, for you to decide what should I be looking for to repair this is ask yourself, are you a wrinkler? Are you a sinker? Are you a sagger? Or are you a shrinker? And a lot of us are all four of those, but some more so than others. So if you're a wrinkler, if you have problems with hyperactive muscles in the forehead, or crow's feet areas, or fine lines in through there, you're talking about wanting to relax those hyperactive lines with one of your toxins, Botox or Dysport. The little fine lines you can take care of with some chemical peels. You can do with little microdermabrasions, dermaplaning. You can go ahead and put on some good topical therapies that we use that actually treat some of the retinoids. There are treatments you can do for that also. If it's a little more aggressive, a little heavier in there, a little more aging, you need to do some CO2 resurfacing, especially the fractionated resurfacing or erbium. One of the lasers will take care of the deeper. So that would take care of the wrinkler part, okay? Are you a sinker? In other words, have you lost volume? Have things caved in? Do you have sags down in your neck? Do you have big grooves in through there? Has your jaw receded in? In those cases, if you're a sinker, you need to have fillers. You need to have some volume that goes in, such that if you had, for instance, a big hole in the wall or something, you would fill that in with some putty, and then you would go ahead and paint over it. So sometimes before we paint, do the peels and the lasers and everything, you'd want to fill in volume. So if you've caved in through there, the fillers. Now, all fillers work well. It's just some last longer than the others. Of course, the longest lasting being Artefill, but there are plenty of other good fillers on the market too. And we'd need to talk about and see what would be best for you for the long-term fill. The little fine lines, you're not going to fill fine lines. Again, you want to do the either the peels or some of the things we talked about. Now, are you a shrinker? Have things gotten in and caved in for that also? Has your jaw receded in? Has your jaw receded up? So if you're a sinker, then you want to go ahead and talk about, again, fillers again and possibly some of the other treatments that were there. But again, revolumize. So take care of those issues. And the last thing that you need to figure is, am I a sagger? Okay. Do I have loose and lax tissue? Have I been out in the sun too much? Do I have bad genes as far as good support? And so if you're sagging, we need to tighten up. And a lot of ways to tighten up. Sometimes with the lasers, we'll do some good tightening. The best ways to tighten, of course, is going to be doing radio frequency, such as our Thermogen, which we did with you before for under the neck, or the Othera, which we've also, I think, done with you, which will using ultrasound to tighten the skin. So you want to shrink wrap the collagen to tighten things up. So there are multiple modalities to treat your aging changes, your wrinkling changes, the sad changes, but again, it depends on the cause and depends on the result, what you're going to be using. One thing to remember now is that when you go into a doctor's office and you're talking about this, you need to go someplace that's going to have a lot of modalities. Okay, they've got a lot of things to choose from. You can choose to do this, this, or this. They all work in different. The big thing to remember is if you have a hammer and that's all you have, everything out there is a nail. So one size doesn't fit all. You want to go ahead and use things and do that. Now, sunscreens. This time of the year especially, you really, really, really need to use proper sunscreen, something with zinc or titanium. If you're going to spend the money to fix this, protect your investment. Use your sunscreens regularly. Okay? So that good skin care, good sunscreens, and repairing what's wrong with this is the way to go. Come by the office. It's a free visit. We can talk with you or choose your physicians widely. There are a lot of good offices here that will do that too. So come see if you need something.